Dr. PT Christine Piaton is on now. To participate, call 1-800-375-2872 or email askme@drptpodcast.com. This is Dr. PT Christine Piaton.
Welcome back to the Dr. PT podcast. I'm your host, Dr. Christine Piaton, an orthopedic and pelvic health physical therapist. This show is for you to be able to call in and ask your questions about those common aches, pains, and pelvic floor symptoms that are interrupting your day, but what's not so common is knowing what to do to actually get rid of them. So this show is made for you to be able to call and ask me directly. And I can then give you actionable steps to be able to better treat those issues so they can be gone for good, or to at least be able to give you some better support so that you can keep enjoying your life to the fullest. Now, for today's show, as well as future shows, you have 3 different ways that you can get in touch with me. So number 1, call us here directly. Our phone lines are open at 1-800-375-2872, so I can answer your call live here right now. If you're a little too shy for a phone call, but you're here on the live stream, you can also drop your questions down in the comment box below here on our live stream on YouTube, and my team will make sure to get those questions to me as well. And then lastly, you can also send me an email at askme@drptpodcast.com. So 3 different ways to reach out to me so that I can help you feel better sooner. So for today's show, I also like to bring in an educational topic to help teach you all a little bit more about your bodies, because I'm a firm believer that if we know a little bit more about our body, then that invites more curiosity about how to better care for it. And none of us were really ever given a good introduction to this thing that is our amazing body. So that is also another important piece of why we like to do this show, to help expand that knowledge toolbox for everyone. So today's topic is related to pregnancy. So if you are planning to get pregnant, if you are currently pregnant, or if someone close to you is planning on expanding their family, this episode is important on all sides. So I encourage you to listen even if you are not currently pregnant, because the likelihood of having somebody close to you that is or might benefit from this information so you can send it their way is high. So for today's educational topic, we're going to be unpacking back pain and pelvic floor symptoms during pregnancy. Why are these things so common? And also addressing how exercise is an essential piece to solve back pain and pelvic floor symptoms and to support your body through pregnancy so that you can reduce and avoid a lot of those common aches, pains, and pelvic floor symptoms. Because the good news is these things are very common. And then unfortunately, people think common means normal. But these things are common because women deserve and need better information about how to incorporate strength training while they are pregnant. That is the essential takeaway for today. So if you were to just log off and not listen to anything else from today's episode, please don't do that. But if you did, the solution is strength training. We need to be lifting weights while we are pregnant, and ideally even a little bit before if possible, to set your body up for success for the big deal that is growing a human, the 9 months that your body goes through significant changes, not just your pelvic floor and not just your abdominal muscles, but literally every part of your body. And also so that we have that strength when we enter postpartum and motherhood, because motherhood is an athletic event every single day. The lifting, the loading, the carrying, the squatting, the swaddling, the nursing, the list goes on. All of these things are not light loads. They are also very repetitive in nature. So we need a lot of strength to be able to do them well and to do them often. All right? So if you are currently pregnant, I want to encourage you, if you're not already, to pick up some weights. That's going to be my goal today by the end of this episode, is to encourage you and convince you that that is what you want to be doing if you're not already. And ladies, if you are already doing that, please keep doing that. You are rocking it. Okay? So one big piece that I like to point out to all of my, because when they come in, their number one goal is, I really want a strong pelvic floor during my pregnancy. And I want that for you all too. But what most people don't know is that a strong pelvic floor is a product of a strong whole body and a strong core team. So if you listen to our previous episodes, I unpacked what is the core team, but I'm going to give you the Cliff Note version real quick here. Your pelvic floor does not work in isolation. It works on a larger team. And your pelvic floor and your pelvic floor strength is only as good as her squad. So ladies, you know what I'm talking about. We are only as strong as the strong ladies on our team, our close friends, right? That's a product of us. Your pelvic floor works the same way. She is a product of how is that strong team around her, and that strong team being the core team, which is made up of the pelvic floor, your abdominal muscles, your spinal muscles, and your diaphragm, that main breathing muscle in the base of your rib cage. All four of those are what help your body to stay strong through your torso, which is important for our whole body to be able to move well. So to have a strong pelvic floor, we need to have a strong core team. And in order to have a strong core team, we need to have regular strength training happening in our week. This is true for pregnancy and also true not during pregnancy. But today's episode is about pregnancy, so I'm going to keep it on point. We need to be lifting weights as part of our weekly routine when we're pregnant in order to support all of the big changes that your body is going through. Most women don't know that, or they're too afraid to lift weights because many people don't have experience with this. And I totally understand that it can be very intimidating to pick up weights when we've never done that before, or not really knowing where to start. And I'm going to unpack that as we go in the episode. And also thinking about a lot of the misinformation that people find on Dr. Google or from other providers that might be on their prenatal team. We're going to unpack this too. Now, I completely understand that when you are Googling what is safe for exercise during pregnancy, you can get set down a million rabbit holes, most of which have a lot of misinformation. And the overwhelm of that is really hard to try to figure out, should I believe this part? Does this part apply to me? Should I do that? Ooh, that sounds risky. You know what? Actually, this is really overwhelming, so I'm just going to not. And if this wasn't my job, I would probably respond the same way too. And then we have this added layer of vulnerability, which is, I don't want to hurt my baby. That's a big deal. And so when my patients come into my office asking me all of these questions, I understand. So if these are questions that are coming up for you too, know that you're not alone. And what I'm unpacking here in this episode is a culmination of all of the questions I often get asked by my prenatal patients. So, the misinformation and the fear-mongering around what is safe or not safe during pregnancy for exercise is actually the bigger issue. That's what's unsafe. It's confusing women about what they should or shouldn't do, which, spoiler, for the vast majority of people, there is no safe or unsafe exercise. That's a good thing. We need to be moving in ways that make our body feel good. We also need to be focusing on working our core and our hips and strength training on a regular basis. And for most people, that is not going to be a safety issue. Good news. People not lifting weights and not doing that on a regular basis is actually the piece that becomes unsafe. That is what increases back pain. That is what increases pelvic floor symptoms. That is what creates more people being in pain and then pulling back from exercise, which then makes us less healthy, including your baby that is on board. We have so much research that confirms that exercise is essential for keeping our body healthy, especially when we're pregnant. The recommendation is 150 minutes of moderate to vigorous exercise every week. That breaks out to about 30-minute sessions 5 days a week. Sadly, only a fraction of pregnant women are meeting those standards. And a big piece of it is because of aches, pains, pelvic floor symptoms, and confusion. So instead of being afraid of not choosing the right exercise, I want you to be focusing more on, I want to be as strong as possible for me and my baby as I go through pregnancy. Let's flip the script here, because also the fear-mongering around safe versus not safe immediately starts the message off in fear instead of empowerment. Lifting weights builds more capacity for our body, which helps us to be stronger and more resilient, which is what we want for pregnancy, but also when we get into postpartum, when we're caring for our little one, because that is a lot of heavy lifting, loading, and carrying out of the gate. All right. The other big piece that I want to unpack here is also inviting you all to be thoughtful and discerning of who is giving you exercise recommendations and guidance during pregnancy. Do not just listen to everybody. Do not just listen to what is on Dr. Google. Do not listen to what is just on Dr. Social Media. And also ask questions from the providers on your team when they're giving you exercise recommendations. Okay? Here's why. I cannot tell you how many of my patients come in to see me and say, hey, I was told by my OB or my midwife that I need to stop doing X, Y, or Z because I'm X number of weeks in my pregnancy. Okay, so when I then follow up and I go, oh, what other additional information? What was the why behind that other than just the number of weeks? A lot of times my patients say, they just told me that at this point I should take it easy. My body's going through a lot growing a baby. If we do not have a specific medical condition that is making exercise something that we need to change, we do not need to make a change to your exercise program. It is essential that we keep moving often during pregnancy so that we can be as strong as possible as we go into the postpartum period. The more muscle that we can have in our body and the better cardiovascular fitness that we can have, that makes your healing and recovery on the postpartum side that much better and more streamlined. It also reduces your risk of having long-term injuries and also reduces the risk of more serious pelvic floor issues. That's what we want to focus on. That's what we want to shoot for. Exercise is the solution to that, not pulling back from it. So if you have providers that are telling you you need to stop, I want to encourage you that you need to ask why. They need to give you a good reason. And if the reason is, just take it easy, you're getting into your second or third trimester, as an example, that is not a good enough answer. Also, if you are in a group fitness class, this is another one that a lot of my patients run into. The instructors might start to recommend that they take it easy or, hey, modify that exercise. You don't know the background or the education that instructor may or may not have. Ask them. Ask them why they're recommending that you modify something. If they have a good reason, carry on. But most of the time, it's a statement that is just being regurgitated rather than one that is founded in fact. So make sure that you are taking exercise advice from someone who knows. And if you're not sure, ask. And if you're still not sure, then I strongly encourage you to bring a pelvic floor PT on your team who specializes in prenatal and postpartum care to help you answer those questions. Because that is our lane. That is our expertise. That is what I help my patients figure out on the daily. You deserve that too. Okay? So be thoughtful of who you take recommendations from in terms of exercise, because not everyone has been trained to know what needs to change or what needs to adapt or what do you need to do as you go through your pregnancy. You get to be the expert in your body, and most of the time the answer is we can keep going. We might need to make changes if something doesn't feel good. We might need to change the speed that you're moving at. We might need to adapt some of the intensity as we get further along into your pregnancy. But a full stop is very rarely needed unless we have a specific medical reason. All right. So I'm going to pause here, but in part 2, we are going to further unpack some of the most common exercise myths that I am constantly debunking in my office with my patients. But I'm going to pause here and answer a few emails while we continue to wait for other people to be brave to call in. So if you have questions about pregnancy, postpartum, pelvic floor, or any other part of your body that is related to physical therapy, don't be shy. Give me a call at 1-800-375-2872, or you can drop your questions in the comment box on our YouTube live stream if you're too afraid to give me a call here. All right? So as I mentioned in the intro, people are welcome to send me emails at askme@drptpodcast.com. So one email that I received recently was from Sue, and Sue said that she's been listening to the podcast and really enjoying the show. The last episode that was about knee pain was really helpful for her, and she wanted to send me an email about some follow-up questions. She said that she is an active 59-year-old who works out 5 days a week and does a combo of weights and cardio. Love that. And she said, I recently started having plantar fasciitis that started in both feet, and it's been ongoing for about 2 years. She said that she went to a podiatrist and she got some x-rays, and they said that there are some heel spurs that she is navigating. She was recommended to go to PT, did 6 PT sessions, and they worked on reducing some of the tension in her calf muscles and gave her some stretches to do at home. She said she saw some relief in her calves, but not much else. And then she went back and saw her podiatrist again a few months later. The podiatrist's recommendation was to take ibuprofen on a daily basis, but she said she doesn't want to do that. I concur. And she also recommended a surgical option and said to let her know when she was ready for that. Sue says, my question is, I would like to avoid surgery if possible. What are your recommendations? Meaning mine. So Sue, I'm really glad that you're wanting to think about this more than just take ibuprofen and sign up for surgery. Because plantar fasciitis is a symptom of the body saying, hey, I need more strength in my feet and in my calves and possibly up at the hip because these areas work together. So ibuprofen is not going to fix that. And a surgery is also alone not going to fix that. We got to be addressing how the body is moving because a heel spur is a calcification that the body places in an area that is having a lot of extra stress to it. Extra stress means we're not distributing movement well across that area for some reason. Okay? So here are my recommendations. You're pointing out a really important piece about the podiatrist recommending orthotics and sending you to PT, but what I'm hearing with PT was that we did not work on any strengthening. We worked on stretching. Stretching alone is not going to build more capacity into our muscles and our tissues for movement. So we have an opportunity here to work on strength. Orthotics and stretching can be a helpful short term while we're having symptoms that are really painful, but then we need to start moving towards how do we build more capacity in the muscles around that area. And also towards other parts of the body that work with the foot. So the foot and the hip are teammates. So often things that are going on down at the foot, we need to be looking up at the hip to make sure that we have enough strength and capacity up there that's not overloading how we land through our foot when we walk and move. We also need to make sure that we have enough calf strength and intrinsic muscles in our foot strength. So think about your arch and all those muscles on the bottom of the foot. So we need to be working on both of those areas. So Sue, I would recommend finding a new PT and asking more directly about wanting to work on strengthening through your foot, your calf, and also checking in, do we need to work on more strengthening around our hip? I would also recommend that you explore this first before consulting or considering a surgery. A lot of times the research shows that even with heel spurs, the first line of defense is physical therapy, and a lot of times we can mitigate a lot of pain and discomfort and avoid a surgical recommendation. So start there first. And then if that's still not fixing things, then we may need to consider a more serious option in terms of surgery. And then I would still be recommending the same thing that I just said, because surgery does not replace movement. It does not reteach the body how to move. We still need to do that with strengthening afterwards. So you're asking the right questions, Sue. Thanks so much for this question. So I'm going to pause here and we're going to go to break. But when I come back, we are going to dive back into the educational topic of today. And I'm going to be unpacking the really common exercise myths that keep getting perpetuated into society for people who are pregnant. And I'm going to help you know what you should listen to and what you should pay attention to and what you should say bye-bye and unsubscribe to. So I'll catch you when I come back. As a doctor of physical therapy, I'm all about optimizing health and wellness. We start to lose collagen, the most abundant protein in our bodies, when we're in our 20s. And that really ramps up after 40. Native Path Collagen can help replenish this essential protein needed for healthy bones, joints, skin, hair, nails, and digestion. Native Path is packed with the types of collagen your body needs most. With just 2 scoops a day, you'll get 18 grams of protein. It's completely flavorless and easy to mix into any drink. There are no fillers or additives, and Native Path is a third-party tested for purity. Get to getnativepath.com/drpt for a special bundle deal at a fraction of the retail price, plus free shipping. That's getnativepath.com/drpt. Feel better, look younger, and start your transformation today. I do not need a miracle in a bottle, just a product that actually delivers on its claims. And that's why I'm excited about Vibriant's Super C Serum. Super C Serum is designed to replace all the things people my age and older start adding to their daily routines, like day creams, eye creams, night creams, neck creams, wrinkle creams, and the dark spot reducers. It's created with the highest quality vitamin C on the market, plus hyaluronic acid, vitamin B5, vitamin E, and other trademark ingredients. It's gentle enough for sensitive skin, but guaranteed to deliver noticeable results, or they'll give you a refund within the first year. Simplify your skincare routine with Vibriant's Super C Serum. Go to Vibriance.com/DrPT to save up to 37% off. Plus, get free shipping. That's VIBRIANCE.com/DRPT. Vibriance.com/DRPT to save up to 37% off and get free shipping today.
This is Dr. PT Christine Piaton. To participate, call 1-800-375-2872 or email askme@drptpodcast.com.
Welcome back to the Dr. PT podcast. I'm your host, Dr. Christine Piaton. We are taking live calls if you are catching us here on the show at 1-800-375-2872. I have a caller here. We have Barbie. Barbie, thanks so much for joining the show. What's your question today?
Sure. Thank you, Dr. PT. I heard this advertised on a Dr. Laura program. I was so excited. I'd love to have a second opinion.
Yes.
Or a first opinion at this point.
No, that's okay too. I'm so glad that you joined.
I have a pelvic... No, thank you. So my history, I have a pelvic organ prolapse about almost 4 years ago now, had surgery to repair it. Mm-hmm. I did not want mesh or anything. So what he did, it was a trifecta. I had the uterus, cystocele, and rectocele. Mm. He tacked up my uterus and then repaired the cystocele using stitches in my own tissue.
Okay.
And he said after he had done that, the rectocele looked good, so he didn't address that.
Okay.
Since then, I use a Pessary, mm-hmm. but it has gotten a lot worse. And I did do PT afterwards.
Awesome.
I'm still active. I look back, I try to figure out why did this happen. I mean, I have 2 children. Mm-hmm. I was active before pregnancy and after in both.
Love that.
I wonder, after my second birth, I remember a nurse commenting saying that she could see my cervix. And I didn't think anything of it at the time, but now I look back and think, wow, was I already prolapsing? And how normal is that?
You're asking all the right questions.
Also possibly about 4.5 months postpartum with that second child, I did a mini triathlon. So was training before birth and after for that.
Yeah.
And I just wonder, was that too much? Because I had no education on at that time. I mean, we're talking, this is over 40 years ago.
Yeah.
So we weren't told, all we were told is don't run if it starts to hurt. So I never did. As I got bigger, you know, if I felt tension in my belly area, that's when I stopped running.
Yep.
And otherwise, it was keep working out. Just don't let your heart rate get up too high. So, I mean, still working out, but now the bulge is, I'm waiting to make another appointment because I really don't want the mesh. And I think if my tissue didn't work the first time, what are the odds of it working this time? I don't think they're very good. Now I have, it's both rectocele and cystocele. The rectocele is to the point where occasionally, almost daily, I have to insert my thumb and push the rectocele back in order to totally void.
Correct. Yeah. What we call a splinting technique.
What's your opinion?
So, Barbie, you're asking all of the right questions. So, first and foremost, I will say it is not uncommon, unfortunately, for prolapse surgeries to sometimes have, within the first 5 years, to notice that it feels like we have a prolapse again. So what we call, sadly, a failure rate of the prolapse surgery. It sounds like you had a better situation than most, which is that we, have a pessary for support. We were referred to pelvic floor PT after the surgery, and that you are someone who is thoughtful about maintaining exercise. All of those things are really important and beneficial for supporting the things you're mentioning. Where I am thinking more for you is saying, hey, when was the last time have we had a follow-up with a pelvic floor PT to reassess and reevaluate what is the strength situation going on at the pelvic floor, reassess what's going on in terms of the new symptoms that you're feeling? Is it more of the rectocele, which hasn't been, surgically reconstructed from my understanding with you? Are there other, conservative tools that we can be using to help support that? And then the other piece that I'm always looking at with patients, even if we had a pessary before, there's different sizes, different styles. Sometimes a pessary that was working for us before, sometimes it needs to be changed and updated. So sometimes getting refitted for a different pessary can be another option and tool.
Okay.
The other piece also with the pelvic floor PT is taking a look at how are we managing what is called intra-abdominal pressure. How do we brace our core when we're doing strength training, when we are running, when we're doing whatever the activities are that you enjoy? Because oftentimes with my patients, I find that we may still need to be working on improving how we're doing that, because we may not realize that we are bracing our core, but we are creating a downward pressure that's overloading our pelvic floor, even with all of the good, thoughtful strength work and exercises that people are doing. How we are sequencing those core muscles matter, and that can actually contribute to some of the things you're mentioning too over time.
Now, have there been any advances in surgery, or, what? Obviously, I go see a urogynecologist and they're surgeons, so they think that's the end-all solution.
That's their toolbox. Yep.
Right. Is there anything new out there in the past couple years? I mean, they tried my own tissue, it didn't work. I mean, the mesh, I'm still sexually active. I read rectocele repair with mesh can sometimes be uncomfortable for my husband.
It depends on the surgeon.
What's your opinion there?
Yeah, it depends on how the surgeon is performing the surgery. There's lots of different techniques that they use. So these are all helpful questions to be asking whoever you might be considering having a surgery with. And anytime we're having a surgery, I always recommend getting more than one opinion if possible on your case so that you can have more information. And so all of the things that you're doing in terms of wanting to be really proactive and asking all of those things ahead of time for your quality of life as well as the quality of life with your partner are really thoughtful. I wish that I could say that we definitely have all of these other advanced techniques within the last 5 years. I don't think that we have a significant amount that's changed in terms of prolapse surgeries. And sadly, that's a big piece of that is because it's women's pelvic health. And that is not the biggest priority when it comes to research and surgical interventions, unfortunately. But I would say that there are still some other options here for you in terms of more conservative treatment around revisiting pelvic floor PT and seeing what else, or kind of an update on that, considering changing the pessary and seeing if a different style or a different size or both might be more supportive for what you are noticing and experiencing. And then the other pieces, which is not as, it depends on the surgeon, but PRP injections for the pelvic floor and surrounding tissues is another place of newer treatment, depending on if you live near a bigger city or things like that, that might be something to consider and have a conversation with your urogynecologist about. So these are other things that could be considered.
The PRP, is that to strengthen the tissues, or what would that do?
Yeah. It's to help with regeneration of tissues and support. Yeah. And I would still say that still doesn't remove wanting to see the pelvic floor PT and addressing all of those things and making sure from a movement and muscle strength standpoint that we're doing all the things there. But that is another piece that could be considered and explored for you.
Okay, right. I try to be cognizant of everything I lift, or, I really try to, but yet, it's worse than it was. It's sad to say.
I totally hear you.
Okay.
Yeah. And I just want to commend you, Barbie, for everything that you're saying. Like, I can tell you're doing the research, you're being thoughtful, you're not just going through the motions in terms of, hearing these recommendations and moving forward without being informed. So keep doing that and ask those other follow-up questions like I mentioned and see what other options could be explored for you.
Okay. All right. Well, thank you very much. I mean, that surgery was not fun. It really, I was surprised.
I agree with you.
The recovery. Yeah. I mean, because combination of factors, maybe it was the anesthesia or whatever, but I did become constipated during the recovery, and oh Lord.
Right. And that's a common development. Yeah, it's a common development just from being under general anesthesia. It slows our GI system, and that often takes a certain amount of days for the system to recover from that. And then to your point, constipation is another common development that is a side effect of that. And then when we're going through a pelvic health surgery, that is more challenging, especially when we're having constipation. It's already uncomfortable for any surgery, but then even more so for what you were recovering from. So just wanting to echo that.
Yeah.
Absolutely.
Yeah. And I take a stool softener in the morning pill form, and then at night the glyco, whatever, it's basically, I look at it as plastic that I'm putting in my body, just drinking that down. Is there any way I can get off that now, or am I I'm so fearful of getting constipated. So do I need to continue both of those?
So that's a really good question also to ask your provider about. I would say I usually don't want people to go cold turkey, especially when their body has kind of gotten acclimated to those different things. That can be really challenging and back you up the other way. But also wanting to echo with you saying, hey, what things are necessary to be taking, along with just being thoughtful of whatever fiber you are naturally eating in your day. Also being thoughtful of hydration and things, because all of that is really important for helpful GI health and having, being able to avoid constipation. The other big piece here, if you're not already, is using a squatty potty to be able to kind of put you in a better position when you are having a bowel movement on the toilet. And so that also reduces extra stress and strain on the pelvic floor and things like that too. So those would be my bigger recommendations around those things. Yeah.
Yep.
Exactly.
Yep. Actually have one. Now, just one last quick question. We're traveling, and where we're going does not often have Western toilets. It has they call them squatty. I look at that and I am fearful. Number one, I don't do a lot of squats because that's not good. And now I'm thinking I'm going to be squatting down and then trying to relax to relieve. And I'm just thinking it's not good for me to squat down to eliminate, is it?
So that's where I'm going to pause you right there. Squats are really, really important for supporting our pelvic health, our hip health, and being able to have a good balance across those things. I do not want you avoiding squats. Squats are essential.
Okay, just doing them properly.
Bingo. How we're doing them matters. How we're breathing while we're doing them and those kinds of things. If you are traveling somewhere that is going to have, a lower toilet situation like you're describing, we ideally want to have some other support like, a partial stool or whatnot so that you're not having to actively hold yourself in that deep squat while you're trying to eliminate, since we're not used to doing that. And we don't have capacity that we've built up over many, many years here in the U.S. like other countries might. So that would be a suggestion around, asking maybe at your hotel or wherever you're going to be staying, are there other supports that can be put in place? Or if you want, you could possibly pack a foldable squatty potty. And because it has kind of that cutout on it, you kind of manage to sort of sit on it to support yourself, but being able to go to the bathroom with, the kind of the stool underneath you instead of having your feet on it.
Right.
So being able to use it possibly in that way could be another way to reverse engineer that. Okay.
All right. So now when you say squats are good, deep squats or?
So I usually start more with people of saying, hey, think like from a bench first, and we need to build some capacity at kind of a lower, a shorter depth first, and then working through a more functional depth. I don't need people getting their booty to the floor. That's not necessary for most people unless they have a specific goal where that's needed. Mm-hmm. But being able to do where our hips come to kind of our knee height and back up for life, and being able to get in and out of chairs, bed, doing all those types of activities, absolutely. And working on that with my patients all the time. Yes. Essential for life.
Okay.
Yep.
I can do that, but okay. All right.
Yep.
All right. Well, thank you very much.
You're
Lots
so
of good
welcome.
information. I appreciate it.
You're welcome, Barbie. Take care. Thanks for calling.
Take care.
So one big piece I want to unpack here again, based on Barbie's question. So it is very common for people to be fearful about doing movements like squats. I also have patients that become really fearful about doing lunges, and especially about getting down, up and off the floor, especially when they have pelvic floor symptoms or have a history of pelvic organ prolapse. I understand the concern here, but we have to be able to work towards building up more strength and capacity to be able to do those activities well, because it helps to support our pelvic floor strength. If we can't do those activities well, or we start to pull back from doing those things, we lose a significant amount of strength, not just at the pelvic floor, but also the neighboring hip muscles. Not having enough strength in these areas leads to overloading our pelvic floor. This leads to worsening of pelvic floor symptoms over time, and also increases the likelihood of developing other injuries. Most notably, low back pain becomes a really common one. Not the only one, but a common one. So I want you to be less afraid about squatting and lunging, and instead wanting to learn how to do it well. Being able to do that well is going to give you a lot more capacity for your body, but also for life, because we need to be able to squat to get in and out of a chair, on and off a toilet, in and out of a car, getting out of bed, getting things off the floor. Occasionally, gravity's going to win and is going to knock us down, and we need to be able to get back up. Being able to have that capacity means that we have to be able to practice our lunges and our squats so that we're going to be able to do that for a long time. All right? So really quickly here, based on our time, I'm going to still pause. I'm going to come back to the exercise myths related to pregnancy. I'm going to answer an email here that came in before we wrap up and go to our third segment. I received 2 emails recently about having a cyst inside of kind of the vaginal canal. And so both of these individuals were asking, can I avoid surgery? Is draining the cyst a viable option, or are there other options? And so in general, when we have a cyst, the biggest piece is saying, hey, are we having pain or discomfort with that? And is it, blocking part of the vaginal canal for, important health reasons? If it's not causing any pain or discomfort, then it can be monitored, as long as you are comfortable with that and your provider can help monitor it over time with you to make sure that it doesn't continue to grow too large. Other options can absolutely be draining the cyst, but reoccurrence is common. So these are other questions and things to have with your provider and being able to monitor it over time. And then if they do try draining it and it keeps reoccurring, then yes, surgery is often the next recommendation to be able to remove the cyst fully. And then, of course, I always say, hey, have a conversation with your doctor if they are recommending a surgical intervention. And if you go through with that and are still having some pain or discomfort, do not dismiss that. See a pelvic floor PT to be able to further address the scar tissue that can sometimes likely happen within that vaginal canal in that area. We are trained to be able to know how to address that, how to help improve that mobility to that tissue, to reduce the pain, discomfort, those types of things, and to be able to help educate you on how to further support that at home. We are the rehab people that know how to do that. Unfortunately, those are not tools that the surgeons are taught. So be an advocate for yourself and ask for that referral, because unfortunately, they probably will not proactively give it to you. So just know that you can ask for that to be able to have follow-up support if needed. Right? So we are going to pause here and go to break. And then when I come back, I'm going to unpack the exercise myths like I talked about, and being able to give you some other actionable tools on how to better strengthen throughout your pregnancy with specific exercises to make sure that you're having that in your weekly routine to keep your body strong as you're growing your little one. I'll catch you when we come back. I do not need a miracle in a bottle, just a product that actually delivers on its claims. And that's why I'm excited about Vibrian's Super C Serum. Super C Serum is designed to replace all the things people my age and older start adding to their daily routines, like day creams, eye creams, night creams, neck creams, wrinkle creams, and the dark spot reducers. It's created with the highest quality vitamin C on the market, plus hyaluronic acid, vitamin B5, vitamin E, and other trademark ingredients. It's gentle enough for sensitive skin, but guaranteed to deliver noticeable results, or they'll give you a refund within the first year. Simplify your skincare routine with Vibriance Super C Serum. Go to Vibriance.com/DrPT to save up to 37% off. Plus, get free shipping. That's VIBRIANCE.com/DRPT. Vibriance.com/DRPT to save up to 37% off and get free shipping today. As a doctor of physical therapy, I'm all about optimizing health and wellness. We start to lose collagen, the most abundant protein in our bodies, when we're in our 20s. And that really ramps up after 40. Native Path Collagen can help replenish this essential protein needed for healthy bones, joints, skin, hair, nails, and digestion. Native Path is packed with the types of collagen your body needs most. With just 2 scoops a day, you'll get 18 grams of protein. It's completely flavorless and easy to mix into any drink. There are no fillers or additives, and Native Path is a third-party tested for purity. Get to getnativepath.com/DrPT for a special bundle deal at a fraction of the retail price, plus free shipping. That's getnativepath.com/DRPT. Feel better, look younger, and start your transformation today.
This is Dr. PT Christine Piaton. To participate, call 1-800-375-2872 or email askme@drptpodcast.com.
Welcome back to the Dr. PT podcast. I'm your host, Dr. Christine Piaton. Our phone lines are open to give me a call here as we round out the third segment of the show. Give us a call at 1-800-375-2872, or you can shoot a comment down below on our live stream and my team will get it to me. I want to give a shout out to a comment from Denise in the live chat. Denise said that doctors don't tell us enough about pelvic prolapse until it's too late. We need to start telling women about this. Denise, I 100% agree with you, and thank you so much for this comment and for pointing out that we need to be better educated about our bodies earlier. Pelvic organ prolapse is a really common diagnosis for many women. And for those of you who don't know what that is, it basically can involve the bladder, the uterus, or the rectum, or a combination of all three. And prolapse means that those internal organs have been impacted in terms of their support structure. So there are ligaments and suspensory tissues that hold those organs up in addition to the pelvic floor that is underneath. There are a lot of different reasons why those support structures may be injured or impacted, and then that means that those internal organs are then collapsing into the vaginal canal. That collapse, that leaning in, then gives women this sensation of kind of heaviness, discomfort, and can contribute to other pelvic floor symptoms. So one of the main contributing factors for pelvic organ prolapse is actually vaginal deliveries. And most women are not counseled on this. So this is something that I am having more regular conversations with my patients in their prenatal visits to educate them on this topic. Because I agree, more people need and deserve to know about this so that they can ask appropriate questions with their birth providers to know about this. And also the other big piece on this is when we get to the postpartum recovery section, that most women are just given the all clear at that 6 to 8 week mark, not given appropriate recommendations for healing and recovery postpartum. And so because of a lack of that support, women are left to figure it out on their own. And without having good rehabilitation of the pelvic floor and full body strength around your core team and your hips, this often leads to more overload on top of those internal organs and downward on the pelvic floor, which can also exacerbate and contribute to prolapse worsening over time. So this is why I'm such a big advocate for women to have access to pelvic floor physical therapy, not just for pregnancy and postpartum, but especially, and also across our lifespan so that we can better support these things. So I'm going to shift gears back to exercise myths, piggybacking off of that first educational topic that we touched on in the beginning of the episode. And these are some of the most common questions that my patients are regularly asking me about exercise when they have consulted Dr. Google, but they're still very confused about what they should or shouldn't do. So first myth, my patients always ask, Should I stop doing core work when I reach 20 weeks of pregnancy? I don't know where this silly rule keeps getting perpetuated and kicked down the street about continuing to tell women that they need to stop doing core work. Crunches and planks may or may not feel available for somebody at 20 weeks in their pregnancy. Sometimes they might still be fine. It depends on the person's fitness level. It depends on how well they're able to connect and brace through their core. I've had plenty of patients that can do that well, and I say, you may continue. That is totally fine. I have other patients that are not able to do that well, and they're creating a lot of downward pressure towards their pelvic floor, in which case we need to make an adjustment. So it depends. But an arbitrary number of weeks in your pregnancy does not mean that you should automatically stop doing core work. Core work is essential throughout your pregnancy. Your abdominal muscles are having to lengthen continuously for 9 months while still supporting you and your body. They need strength. If we stop strengthening them halfway through your pregnancy, they're going to be overloaded even more so. And this is going to put more stress on your pelvic floor and your back. And this also can actually increase the likelihood of putting more load across the linea alba, which is that piece of connective tissue that joins the right and the left half of your rectus abdominis, that six-pack muscle. So if you're pregnant, you might have heard or seen on Dr. Google this thing called diastasis recti. And there is this other big myth that is within this myth that says if you do core work past 20 weeks that you are going to increase the likelihood of diastasis recti. That is total BS. Do not subscribe to that. If we are not doing core work thoughtfully, can we overload that linea alba more, and can that increase the likelihood of diastasis? Yes, it could. Also, not doing any core work and allowing weakness to happen throughout your abdominal muscles for the second half of your pregnancy is also going to overload that linea alba. And that could contribute to actually more diastasis. So thoughtful strengthening across your core, working on your breathing mechanics to engage your core thoughtfully, and I have videos on this on my YouTube channel if you want more instruction, matter more. And the other fun fact here is that we have research that shows that for individuals who carry to full term, nearly 100% of those individuals will have a widening of that linea alba that is technically considered a diastasis, because that is a normal adaptation that your body needs to accommodate baby's growth. So once again, we have a lot of unnecessary fear-mongering around this. So core work is important throughout your pregnancy to keep your abdominal muscles strong so that we don't overload those tissues and cause extra strain on the other teammates that are part of that squad, meaning your pelvic floor, your low back, your hips, etc. And if you're unsure about doing that, I have some additional videos on my YouTube channel about what are some helpful core exercises during pregnancy. It's a little 10-minute video that you can follow along. Or, once again, I strongly recommend bringing a pelvic floor PT on your prenatal team to help you more directly. Right? Next myth, number 2. Is it okay if I lift more than 20 pounds during my pregnancy? OMG, please learn how to lift at least 20 pounds, if not possibly more. Here's why. A, when you are pregnant, you are not fragile, but you're not invincible. But 20 pounds and being able to squat and lunge with 20 pounds well is important. Because when you get to the other side in the postpartum period, your baby is going to be 10 pounds pretty quick out of the gate. And also, a car seat empty on average is about 15 pounds. That stroller empty is about 15 to 20 pounds. Do you see where I'm going here? When you add the baby and the stroller, or baby and the car seat, all of a sudden we're at 25 to 30 pounds real quick out of the gate, and I'm talking early weeks postpartum. We need to train for that. And baby is only going to continue to grow and get bigger. Also, if you already have a toddler and you are pregnant in a subsequent pregnancy, we need even more strength and capacity, because that toddler still needs you to carry them, love on them, pick them up, wrangle them as you need to. And so being able to do that, plus while you're pregnant, means that we need enough strength in the body to be able to do that well. So do not be afraid to learn how to squat and lunge at least 20 pounds, if not a bit more, because if we have a little bit more of that capacity, then that's going to give you more resiliency to support your body as you're going through the rest of your pregnancy and have a good strength bank account, as I like to call it with my patients, for postpartum. Because that's where you really need those muscle gains as well, because your body is healing and recovering, but you're still having to carry for your babies 100% out of the gate. So we need as much strength as we can to support your whole body. Pregnancy and postpartum are hard physically, but they're even harder when we're weaker. That's why we want to prioritize strength training and doing it well and doing it often so it can support you through all of these seasons and onward. Okay? The other myth my patients often ask is walking and prenatal yoga enough? My short answer is absolutely not. And that's going to be an unpopular opinion right now, but hear me out. Based on what I just said, in terms of wanting to have capacity with strength training and wanting to make sure if we have enough time and capacity to be able to squat and lunge with at least 20 pounds, if not more, is important because we have to train for what is coming or what you're currently doing. If you're currently parenting a toddler, we need to be able to pick up and lift and load that toddler well and repeatedly. So I'm helping my patients not to being like, tell me how much your toddler weighs right now. And then we are picking up the weights in my office that are close to that because we need to learn how to do that well instead of avoiding it. The other piece, like I said, if you are a first-time mom and you are preparing for your soon-to-be postpartum, more strength we can have there, the better. Walking is a lovely cardiovascular activity, but it does not build muscle strength. It does not replace that. Prenatal yoga can feel really good and help certain people feel good and is nice for the nervous system and bringing some calm to a stressful time for many people. But again, it is not replacing or building muscle strength. We have to have strength training in your weekly routine. It is essential for your whole body and your pelvic floor. All right. And then the last myth that I want to bring up here is one that often commonly gets perpetuated, which is if I'm having pelvic floor symptoms during my pregnancy, should I go to pelvic floor PT or should I just wait and see if they go away after birth? I'm going to tell you right now, they are not going to go away after birth. 100%, no. You need to come and see us during your pregnancy to be able to address those things. They will not magically disappear. Pelvic floor symptoms are symptoms of how your body is moving and how your body is creating support through your torso. These are things that need to be addressed in terms of strengthening and breathing mechanics. They are not something that is just going to go away when baby is here. We have research that shows that if you have pelvic floor symptoms during pregnancy, the vast majority of people will still have those symptoms and they will likely be worse at their 6 to 8 week postpartum visit. And there's a large percentage of people when they have those symptoms at their 6 to 8 week visit will also have them at 1 year and beyond. They do not go away until you come and see one of us pelvic floor PTs to address what is the root cause, what's going on, and helping to address that entire core team that I mentioned in the beginning of this episode. All right? So you do not have to wait. Come and see us so we can support you early on and also so we can help guide your postpartum recovery so you don't have to figure it out on your own. All right. So in closing here, what should you be doing for your strength work? So like I mentioned, we have approximately 150 minutes that are being recommended for you to be exercising each week. This is from ACOG, the American Gynecology Association. All right. And what I like to recommend for my patients is basically if we take that 150 minutes and we break it out to 30-minute sessions, that's 5 workouts in a week. I'm helping my patients to build a routine where they have about 3 of those that are strength training and 2 of those that are cardio sessions. And with that breakdown, we're going to get a lot of good strength throughout the week. And then you have 2 cardio sessions. And then most people are already doing a lot of good cardio, walking, different things like that in their day-to-day activities. So you get enough cardio minutes in the week. Err more on having more strength for those designated 150 minutes, and your body will thank you. The other really important piece. So number 1, we want to be working on core strength. One big piece about core strength that most people don't know or that is less fun when we think about core strength is working on how you are breathing. Your diaphragm is the main breathing muscle on the base of your rib cage, and it sequences your entire core. It is also communicating directly with your pelvic floor. So training your breath and working on that through your pregnancy is going to be the best bang for your buck for pelvic floor strengthening. It's also then going to cue how your abdominal muscles and your spinal muscles co-contract with your breath. When we inhale, there should be an expansion through that entire team. And when you exhale, there should be a contraction and a recoil of all of those members of the team. So something I regularly tell my patients is if you're breathing well through your exercises, you are doing core work everywhere, which is great. And also being thoughtful of the fact that your exhale, if it can be paired with the more challenging part of the movement, that is usually also going to give you better support. So what do I mean by that? Let's take a squat, for example, which is another one of my favorite exercises for everyone during their pregnancy. As you descend down into the bottom of a squat, I encourage my patients to inhale and focus on breathing through their diaphragm and through the back of their rib cage to help expand 360 degrees through their torso as they go down. When they're about to come back up, I cue them to exhale and think about that exhale and that connection coming from their lower abdominals. I give them the cue, hug baby. Hug baby as you exhale like you're blowing candles out as you drive back up to standing. Coming back up is the hard phase of the squat. Similar for lunges. When you come down, that's the easier part because gravity is moving with you. As you are coming back up, you are working against gravity and against the weight that you are hopefully holding after all of my encouragement for strength training. So you want to use that exhale to be driving back upward. Pairing your breath with your movement is a really helpful way to incorporate core work along with whatever other specific strength area you're focusing on. So breathing is core work, as well as having more specific exercises that are appropriate while you are pregnant that feel good for your body. And like I said, I will include a link in the description for our podcast episode here on YouTube that links to some of these things that I've already created circuits on our YouTube page to be able to give you some ideas. We also want to be focusing on hip strength, your glutes, your inner thighs, your hip flexors, and your hamstrings. All of those are attaching to your pelvis and help position your pelvis so that your pelvic floor can be in an ideal position to support you as well. If we have a lot of tension and tightness and weakness in those hip muscles, that's going to impact your pelvic floor. Your pelvic floor is going to get overloaded, and this contributes to more pelvic floor symptoms and pelvic pain. So we want to keep those strong. We also have research that shows women that are able to squat and squat well throughout their pregnancy have approximately a 20-minute shorter second stage labor. That's huge. That's often where we have bigger issues for pelvic floor injuries that result. If we have a longer second stage labor, that will increase the risk for injuries. So squatting alone helps to reduce this by 20 minutes. That is substantial. Plus, it's functional for daily life. So this is another reason why I love squats, okay? We also want to be working on lunges. That strengthens each leg individually, and I like doing them in multiple different directions. Reverse lunges, forward lunges, lateral lunges, right? As well as working on balance training and also working on standing heel raises because your calves and your feet need to stay strong as you are growing your little one. And then finally, do not forget upper body, okay? Your upper body is essential. Those muscles that are in your upper back are doing a lot to help hold your whole body up and to support your neck. You're also having a lot of extra load with increased breast tissue and also all the swaddling and holding that you're going to be doing. So do not skip arm day. We want to have a strong upper body for all of the carrying that you're going to be doing shortly. All right. So thank you for those of you who were brave enough to call in today and ask your pelvic health questions. Thank you for those of you who also caught this on the replay. We appreciate you too. Friendly reminders, we're going to be live here every Monday from 2 p.m. Pacific, 5 p.m. Eastern. Feel free to give us a call, to send me an email, or to drop your comments down in the comment box below like we did today so we can continue to have these conversations ongoing, right? And I hope that this episode also encouraged many of you to consider and get in the gym for your strength training if you are trying to conceive and or planning to have a baby in the future. So thank you for joining me for today. And I look forward to continuing this conversation next week at our usual time. Keep moving well and move often. I'll catch you next Monday.